Hello, everyone. My name is Darren, and I am one of the marketing coordinators with BCIT's School of Health Sciences. And it is my great pleasure to welcome you to the Health Sciences Information Session for the Environmental Public Health Program. First, I want to say how happy we are to see you all, and thank you for attending our presentation today. And I'd like you to feel free to post your questions or comments into the chat during the presentation. And we will do our best to address as many questions as we can near the end of the presentation in the Q&A segment. And if you could all please keep your microphones and video turned off and just until the end of the presentation to help reduce connectivity issues and interruptions, and we'd really appreciate that. So before we get started, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. Our agenda for today is the welcome and introductions. We might do a short poll. Yeah, we'll do a poll just to see where everyone is at. We'll watch an environmental public health video. We'll go through the presentation and program overviews. We'll get some information about program advising, and at the end we'll do questions and answers. And before I introduce Dale, I'm going to pull up some polls for us. Environmental public health specific question. What is not part of an environmental health officer's job description? To inspect food premises, inspect fish and wildlife habitat, inspect tattoo parlors, or investigate communicable disease outbreaks? So please do your best to answer. And with that, I'm going to introduce Dale Chen, the program head, and take it away, Dale. How did everyone do on the poll question?
3 of the 5 people got it correct. Thank you very much, Darren. So the answer is the inspecting fish and wildlife. So environmental health, despite what the name sounds like, isn't actually about the fish and wildlife. It's not necessarily about the environment. It's about public health. So it's referring to how the environment affects your health or the public's health. So think of it in form of most healthcare that you think of are related to illnesses that you get yourself, like cancer, or illnesses that people give each other, like a cold. So those are things that people mostly think about. Environmental health covers everything else. So the water that you drink, the food that you eat, the air that you breathe, the place that you live in, the services that you use that might affect you, your body, like tattoo shops, like hair salons, like nail salons, etc. Those are all covered under the large umbrella that is environmental public health. So we've actually changed the name of the program this past year to environmental public health to better distinguish that for everybody. We used to be just called environmental health, and that always caused some confusion with people in terms of what the profession is. Next slide, please. Oh, it's the video.
Hey, I'm Zach. I'm from Fraser Health.
Pleased to meet you. Want to show you around?
Perfect. So today, I'm doing an inspection here at this food processor. We'll be looking at making sure that sanitizers are available, that the staff are following proper hygiene practices, making sure that coolers and other cooking equipment is functioning properly. So there's a wide range of things that we are working towards to make sure that food safety and sanitation are being followed closely. So I love my job because every day is a new day. I enjoy seeing the collaboration with our health unit and seeing their successes, because when our operators are successful, we're successful.
Our environmental health program here at BCIT trains students to become environmental public health officers or inspectors. And in that capacity, we inspect water systems, restaurants, sewage disposal systems, pools and spas, and we even do tobacco control, making sure stores do not sell tobacco to minors.
I chose to come to BCIT because it is one of the few schools across Canada that offers the environmental health program. The instructors are all previous environmental health officers, and that's great because they can give us a lot of their knowledge and their experience in the field, and they make everything that we learn, they make it really applicable to the job.
Here at BCIT, we work you hard. 2 years worth of very intensive instructions, and we offer a 3-month practicum to all of our students, and so they get their training necessary to become a certified public health inspector after they're done with us.
So in the end of the day, it's about healthy communities. It makes me feel good that I've done my part. I'm a member of that community, and we get to do it together. And that makes me proud to do my job and be a public health inspector.
So what is environmental health, environmental public health? And so I sort of briefly mentioned it, and the video explains it up to a certain point, but really it's everything in the environment that affects your health, right? Ranging from food and drinking water and air, etc. So a typical duties of an environmental health officer or a public health inspector does include going out to your local restaurants and making sure that they're all following proper procedures. I think everything's getting a-okay. Going out to your local pools to making sure the water quality is okay. In the smaller communities, you would also be going out and looking at various drinking water systems. Here in Metro Vancouver, or most of the big cities, they have a whole engineering department that looks after that. So most field inspectors wouldn't be as involved, but you may be involved at a more senior level, for example. So it's a very wide range of duties. People kind of say environmental health officers tend to be a jack of all trades because the scope of duties is so broad. You need to really know a little bit about everything. And we really try to prepare you for that here. So the program itself is a 2-year full-time Bachelor's of Environmental Public Health. The program is on site at the main Burnaby campus, and we are in person. We have small class sizes. We currently accept up to 30 students. And so you do get lots of one-on-one time with instructors. And as mentioned in the video, all of our instructors are past environmental health officers, including myself. So it's a combination of lectures, field trips, and research projects. So to give you both a solid foundation of theory in terms of what is environmental public health, but as well as hands-on experience, as much as you can get anyway. And one thing that's really unique to our program here compared to other programs in Canada is that we arrange a 3-month practicum for you with one of the BC regional health authorities. So in order to become a certified environmental health officer in Canada, you need to become certified with the Canadian Institute of Public Health Inspectors. And the only way to become certified with the Canadian Institute of Public Health Inspectors is to complete one of the accredited programs. BCIT is one of the 5 or is it 6 accredited programs here in Canada, but we're the only ones that arrange the practicum for you. So the practicum is a necessary component of the certification process. The other schools, what happens once you graduate from their programs is you're on your own. You need to go out and apply for different practicum opportunities that are out there, whereas we arrange it for you. So I think that's a major advantage of our program compared to just about all the other programs here in Canada. So what makes a good environmental health officer? So the very first thing on there you'll see is mature, practical, and assertive. What sort of the video doesn't really capture, and not necessarily is that a big part of the job is communicating with people. So as you can imagine, you're going out to different facilities, you're talking and working with various restaurant operators, water system purveyors, etc. It's all about the communications. You can't go around and just sort of slap tickets on everyone. Yeah, you could do that up to a certain point, but it doesn't get you very far, and you end up not making a very big difference. Whereas if you're able to communicate people, educate with people, convince them to do the right thing, inform them in a manner so that they understand why they need to change the way they operate. That will really make you very successful in the field, right? And having that maturity and that professionalism to deliver that message can make all of that difference. Of course, you'll sometimes meet people who will push back on you and things like that. And that's the part where being assertive and confident also makes a really big difference. So coming into this program with strong communication skills, both verbal and written, can make a really big difference. Second is, of course, being able to work independently as well as in teams. And this is very true. Like you see this quite often, this point, being able to work independently in teams quite often for various different professions. But this is very true for our program. When you're out in the field, you're really on your own. You're by yourself. You get to make all the decisions sort of on the ground, so to speak. But occasionally for bigger projects, you have to collaborate with your coworkers or with other ministries. When I was in the field, I've worked with RCMP, I've worked with BC Conservation Service, I worked with Ministry Environment. All of those different agencies, you have to be able to work with others in order to reach a common goal, right? And then the good interpersonal skills, the good communication skills, again, I sort of touched on those. Those make all the difference. And then finally, good problem solving and decision making skills. When you're in the field, as I mentioned, you're on your own. So what's the right call? Most things aren't necessarily black and white. There are some always shades of gray in terms of how you want to handle certain situations. Sometimes you maybe need to draw the line and say, nope, beyond this line is too far. You cannot do that. Sometimes you can say for the greater good or for just in the public interest, it might not necessarily be a good idea to go all the way, so to speak, on certain things. So being able to discern what is a good idea and what is a bad idea, or a good decision or a bad decision, can make a big difference as well, because ultimately you're there to serve the public, ensure public health, and ensure you're creating a safer environment for everybody in the least impactful way, right? And so that's your end goal at the end of the day. So benefits of an EHO career, environmental health officer career. So it's a diverse and interesting job. As I mentioned, of the various things that you cover, so you can imagine going from place to place. You're not in the office all day long. You're actually out and about most of the day, going out to various different facilities. If you're in the city of the geographic area you cover will tend to be smaller. But for example, when I worked, I was in a more rural area. My coverage area was huge, right? Probably in terms of actual surface area, larger than all of Vancouver. So of course there weren't many people there, but I was out and about, and I would drive a couple of hours to reach some of my more remote facilities, etc. So you're definitely, depending on where you work, you get to see many, many different things. You get to work with the public. Some people enjoy that. Some people don't necessarily enjoy that as much. But you do have to know that part of this job is working with the public, both facility operators, but members of the public, general public, that come to you with concerns, with questions. So you have to be prepared to answer their questions, to educate, provide that information in a constructive manner, right? You're working with the benefit of the community. So you get that satisfaction of, yes, I made a difference. I helped to do something good. I'm spending my day doing something productive, and not necessarily just selling a product or something like that. So you get that satisfaction of doing that. And on top of that, many people come into this program with some sort of science background, and oftentimes graduating from, let's say, university with a science background, you don't necessarily kind of see, well, I have this degree, what do I do with it? The knowledge that I've gained, I can't really apply it, right? You end up working as a bank teller or something, and what did I do? Spend my last 4 years studying. So if you are one of those people, yes, you do sort of apply a lot of those scientific principles in your work, right? The standards and the legislation that you end up enforcing, those are all science-based. So having that background is definitely a strength. And then finally, you work outside of the office. I mentioned that, but also you work independently outside of office. So you do have a lot of responsibility on your shoulders. Sometimes when you're out there and the decisions that you make, it does affect other people's lives, right? It affects people's livelihoods. So if you say, see a health concern and you deem that this restaurant must shut down, you're affecting everybody there in terms of their livelihoods and their ability to make a living. So you do have a fair amount of discretion and responsibility on your shoulders. So that I view that as a benefit, right? It's just being able to make those decisions, being confident that you're making the right decision for the greater good. I personally view that as a benefit for sure. So employment, environmental health officers generally work for major public health agencies across Canada. Most of our grads end up working in BC with the regional health authority. So we're thinking of Vancouver Coastal Health in Vancouver, Richmond, Fraser Health for Burnaby out towards the Fraser Valley, Interior Health, Island Health, and Northern Health here in BC. There's also the First Nations Health Authority here in BC that does hire our grads as well. The Canadian federal agencies hire our grads, so such as the CFIA, Public Health Agency of Canada, Health Canada, etc. And with that certification that I mentioned with the Canadian Institute of Public Health Inspectors, you are able to work as an environmental health inspector or a public health inspector just about anywhere in Canada, except for Quebec, because they've got more, they don't necessarily have it as much, but the program that is sci-fi accredited, or that is an accredited program, recently started up as at the University of Montreal. So our hope is that the accreditation will get recognized further in Quebec as well in the future. But currently, all other 9 provinces hire Canadian Institute of Public Health Inspectors certified inspectors to be their public health inspectors. So those are the major employers. There are private companies that hire graduates as well. They're mostly larger corporations that are hiring people to do their internal quality controls. So they can be major grocery chains, food processors, etc., who have that kind of capacity or need. There are private consulting firms that do inspections. So for instance, like a restaurant chain like Starbucks, they have their own contracted out private inspectors to come and audit all their restaurants to ensure that their restaurants are operating in top shape and all their franchisees are adhering to, company protocols and things of that nature. And then there are sort of health adjacent positions at health agencies and private consulting firms, etc. So another one that's not mentioned on here is local governments, actually. So for instance, Zach, who is the star of our video, he, I believe, recently moved over to the city of Burnaby, actually, as one of their environmental services inspectors, I believe. So so that is also, and I've actually know of several individuals that have done similar jumps or who've jumped over to liquor and cannabis inspection with the province of BC, etc. So there's a lot of sort of adjacent type positions that you could move into as well once you've gotten a bit of administrative law and inspection and enforcement experience under the belt. So there's Zach there. So this testimonial that he has is about what happened during the pandemic. He was just pointing out that there was a lot of flexibility in the position and he was able to take time off. And because most of the positions are public sector union positions, the benefits packages and the vacations and etc. are all fairly comparable and competitive. One good thing right now is in the most recent round of union negotiations, the environmental health inspectors got an extra bump. So I'm sure like some of you have already heard, most of those people got a decent increase, but environmental health officers got classified up. So they got an extra increase. So I believe on the top end, people are getting almost a 20% pay bump, which is fairly substantial. So that's so now we the pay is once you've done your, I think, 5 years to reach your maximum pay step, you're probably, by the time anybody who is applying now graduates and gets into the field and reaches that point, you're looking at just breaking 6 figures at that point, I think, in terms of pay. So fairly good, I would say, considering everything else, right?
Well, thank you, Dale. That was a lot of excellent information. You can just have a rest now, and I'm going to take us through some admissions information, and then we'll get back to you in just a minute and see if there's any questions and answers. But right now, I'll be reviewing with you the entrance requirements and admissions process, along with briefly discussing some key student services that are available to you at BCIT. So there's one intake year for the Environmental Public Health Program, and applications are accepted online each year on October 1st until the program fills. And this does not mean you should wait until close to the start date to apply. There are limited seats available, therefore it is beneficial to apply early. And filling out the online application is relatively straightforward. Everything is online these days. Once the application opens for each cycle, you can log in and review the online application. You can work on filling out the application at your own pace, and does not have to go to admission until you pay the application fee. Regarding the application process, you will firstly review all of the entrance requirements, go to the program website for that, and the application processing dates. You will then upgrade if necessary, and BCIT does offer courses that meet some of the requirements in part-time studies, which is now flexible learning. Program advising can assist you with this, and ensure that when you apply online that you have all of your required documents, such as transcripts ready to scan and upload as PDF files. BCIT.ca/admission will guide you through the step-by-step application process. And once you are ready to apply online, you can visit BCIT.ca/apply. And the application fee for domestic students is 90 Canadian dollars and 154 Canadian dollars for international students. Here we have the entrance requirements. The minimum academic entrance requirements for this program are as follows. Proficiency in speaking and listening. So 2 years of full-time education in English or an English-speaking country. 3 credits of post-secondary English. 60 post-secondary credits that include a minimum of 18 credits. A minimum 18 credits at second-year level in at least 2 subject areas. Biology, chemistry, and a minimum of 6 additional credits of science. And there are non-academic requirements. There's a self-assessment form. There's a career discussion with a public health inspector or environmental health officer. A minimum of 1 year full-time or accumulated part-time relevant work or volunteer experience. And you would need a valid driver's license because lots of travel is required. Please note, if you completed your post-secondary outside of Canada, the US, UK, and New Zealand, and Australia, you are required to complete a comprehensive evaluation of your credentials by the International Credential Evaluation Service, ICES. As mentioned, as part of the online application, you will need to upload documents for a timely assessment to be completed. You can download official digital transcripts, or you can convert your transcripts and documents to PDF files. And information on how to convert documents to PDF files is available on our website. For example, you can scan or take pictures of your official transcripts and then save them as PDF files. Please ensure that you upload all required documents to minimize delays in the application process. After you apply, your application will be reviewed by the admissions department to ensure you fulfill all of the entrance requirements. This process can take up to 4 weeks. And entry into this program is on a first qualified basis. This means if you meet the requirements and a seat is available, you will be offered a seat. Once you are offered a seat, you will be asked to pay a commitment fee to hold your seat, and a tuition for first term will be due 60 days before the start of the classes. And currently the commitment fee is $500 for domestic and $3,000 for international students. For laddering opportunities, there's a graduate degree at UBC for occupational and environmental hygiene and Master of Public Health. Graduate degrees at SFU as a Masters of Science or Masters of Public Health. Opportunities in epidemiology and health promotion, Masters in Education or Masters in Global Health. And now moving from the academics, I would like to let you know BCIT is committed to supporting students in a holistic sense. We want you to succeed not only in your academics, but also outside of school. Some of the student services are available to you as a prospective student, and others will be available to you once you become an enrolled student. And here are some of the important student supports that I'd like to mention. If you are Indigenous, BCIT's Indigenous Initiatives Department is there for you to ensure a smooth transition into your first year. They offer peer-to-peer mentorship, a welcoming gathering place, and provide clarification on Indigenous funding. BCIT's awards, scholarships, and bursaries are listed on our financial aid and awards webpage. I would like to mention that we have a President's Entrance Award. Selection is based on academic achievement, but also volunteer and community service. And you can please contact financial aid directly for more information about that. And BCIT is committed to providing assistance to students with permanent or temporary disabilities. So if you have been accepted to a program and believe that you may need accommodation to be successful, I encourage you to connect with our Accessibility Services Department. BCIT's Student Health Services is a health clinic located on the Burnaby campus, and they provide medical care for current BCIT students all year round. And we also have a counseling and student development department available to help you enhance your educational performance and maximize your success as a student at BCIT. And last but not least, our recreation services promotes, encourages, and enables the practice of physical well-being. And we consider recreation an integral part of campus life and welcome all students to enjoy their services. So if you have any questions after today, I encourage you to connect with Program Advising, and they're available by the telephone, email, or Zoom appointment. And you can go to the webpage, bcit.ca/advising, for their up-to-date contact information and service hours. I would like to mention, if you have an inquiry that is time sensitive, please call by telephone for assistance. And this is just a list of the School of Health Sciences social media handles: Facebook, Twitter, Instagram, YouTube, and LinkedIn. And also you can learn more on the BCIT website about tours. Spend a Day, as I believe, is getting back into action, which is a great way to find out. And Big Info, which we do a couple of times a year, is fantastic for learning about the breadth of programs that are available. And of course, info sessions like this, which happen frequently throughout the year. And of course, advising is always there to help you out. And that brings us to the questions and answers. So I have not been watching the chat, but let's have a little look and see if anyone has any questions. If I take food technology, how can I apply for this program? I remember something getting a 2-year credit.
Yes, so we do recognize the courses don't line up precisely, but we do recognize graduates of the food technology program as having fulfilled the entrance requirements. Yes. So Carl, in terms of how you would apply, I would say that once you've mostly completed your food technology and basically are ready to graduate is when you would apply, is my understanding.
And for anyone who doesn't have questions now, but think of something later, you can make a note of these, or actually everyone will be sent a copy of this presentation sometime next week with a link to the YouTube video. So no need to take notes, but here are some very important email addresses. If you do have further questions, you can contact Dale if you have program specific questions, or if it's more about admissions or advising, then program advising is the way to go.
You know, one question that people always have is in terms of employment opportunities. Like I mentioned the major employers, but everyone's always wondering, oh, you know, what are the job prospects like and things like that. I unfortunately can't answer that confidently, and truthfully, I genuinely, I can't answer that confidently. What happened is previously we were the profession was very stable. You know, it wasn't a really rapidly growing profession or anything, because, you know, we're a small program and it was really more about ensuring that everyone has this service, public service. So it was really, you know, a constant people leaving the profession and or retirements, etc. But now when the pandemic hit, there was a huge explosion of need for people. So basically everybody who wanted to be a health inspector, a graduate who wanted to be a health inspector, and for who wasn't hired for some reason got hired. So there became this huge need. Now that the pandemic is sort of dying down, I just honestly can't predict what the future prospects will be like. There will always be that continual need from retirements, etc., and people leaving the field for one way reason or another. But I honestly don't know in terms of anything greater than that, if there's anything on the horizon. And honestly, if we don't have a big pandemic, maybe not, but there will always be that constant, attrition, so to speak, where there's a need. One thing I also want to flag for people is that because we work with all the health authorities here in BC, you do have some control in terms of where you go for practicum, but not 100% control. So you may need to relocate to the interior or to the north in order to do your practicum. So that's another thing that does come up. In terms of if you're still sort of struggling in terms of who the environmental health officers are, if you recall, during the height of the pandemic, Dr. Bonnie Henry was out there saying health officers are doing that, public health officials are doing this. Environmental health officers were the majority of those public health officers. The only other public health officers, so to speak, are medical health officers, and those are physicians, so those are doctors, and there just aren't that many of them. There's only a couple in the entire health authority. So the boots on the ground, so to speak, were our graduates. So that sort of gives you another aspect of the profession, of the job, that sort of wasn't captured in the slides. Mm-hmm.
Excellent. Thank you, Dale. And Carl has asked one more question. Do most graduates work only for public health?
I would say the majority. Some people don't choose not to, but that is more rare. So occasionally people do complete their practicum. They see what it's actually like in the field, and they kind of go, I don't want to. I'm not going to write my certification exam, etc. But I would say that is rare, because I would think that one of the reasons is, as part of the entrance requirements, we're required to go to speak with a health inspector. So most of the people coming into the program have a very clear understanding of what the profession is. So you're not surprised. So, and therefore, most people do end up going down that career path. Occasionally, people do work for other agencies other than public health, such as, the city of Burnaby, local governments, provincial governments, federal agencies, etc., or private companies. But I would say the majority do end up working for public health. Yes. Mm-hmm.
Okay, excellent. Dale, thank you so much. Okay, well, I'm going to thank you all for being with us today, and we definitely wish you all the best in your future in health sciences, or whatever you decide on. It's great to have you, and I hopefully see you on campus sometime.
Thank you very much, everybody.
Yep. Have a great night.